From the start of the pandemic, COVID-19 infections had mysterious twists and turns.
They were healthy before they got COVID-19, telling us that weeks after the initial infection, they were still having lingering problems in the form of brain fog or fatigue and all sorts of different symptoms.
During this time, people experienced varying degrees of uncertainty, isolation, and mental health challenges. It was a lot to take in. But Dr. Ziyad Al-Aly was paying close attention.
To their credit, this patient community, they called themselves long haulers and started to refer to the syndrome or the entity as long COVID.
Al-Aly is a clinical epidemiologist at Washington University School of Medicine in St. Louis, and he's the chief of research and development at the Veterans Affairs St. Louis healthcare system. When people felt helpless, Al-Aly became committed to finding answers.
And we committed right there and then to try to understand, to do our best to try to understand what's going on.
Al-Aly conducted extensive studies on long COVID. He's focused on a variety of symptoms affecting different parts of the body. One of the concerns rising to the top of the list: mental health.
We knew that all of us during this pandemic experienced some sort of stress, right? But what we didn't know, do people with COVID-19 have it worse? So we did this study to evaluate the risk of mental health problems in people with COVID-19 versus control groups who did not get COVID-19.
For the study, Al-Aly and his colleagues analyzed the de-identified medical records in the vast database maintained by the U.S. Department of Veterans Affairs. The database covered the months of March 2020 through January 2021, before the widely available vaccinations. But Dr. Al-Aly helped to prove in another study that vaccinations reduce the chances for long COVID by 15%. So long COVID is still a problem for the vaccinated. The study about the mental health risk from having a COVID-19 infection involved more than 150,000 people with COVID-19 from that vast database.
Compared to the control groups that are together more than 10 million people. What we found are people with COVID-19 had increased risks of mental health disorders, including anxiety, depression, stress and adjustment disorders, sleep problems. Some of them were needing to be initiated on sleep medications, antidepressants, anxiolytics, et cetera, et cetera.
Researchers discovered increasing chances of suicidal thoughts and substance use disorders. The study found that mental health disorders occurred within 1 year after recovery from COVID-19 infections, even when people had infections with asymptomatic or only mild symptoms.
People who got COVID-19 survived the first 30 days. When we followed them for a year later, they manifested with higher risk of mental health problems than people who did not have COVID-19.
Overall, the study found that people who had COVID-19 were 60% more likely to suffer from mental health problems than those who were not infected.
It's very, very clear that people with COVID-19 have increased risk of a variety of neurologic problems and neuropsychiatric problems. That could be explained by the virus itself through inducing some potentially structural changes in the brain or other neurologic alterations that might then lead to the higher risk of neurologic consequences and psychiatric consequences.
The next step for Dr. Al-Aly is to study long COVID conditions after infection from COVID-19 variants.
Addressing it at this point and nipping it in the bud is going to be the best approach, rather than sort of letting it cascade down until it becomes a much more serious problem down the road. And attention to it, recognizing it and addressing it early on is going to be very, very important.